Hi, Kimberly. Thank you so much for being a guest on the Holistic Hub podcast today. I'm so excited to interview you about all things mast cell activation syndrome and mold toxicity.
Well, thank you for having me. Thank you for the invite. I'm happy to be here.
Yay, I'm so excited. So I always love to start with this question for everybody. It's what really drew you into this niche of working with people? Because mast cell activation syndrome, although many people are dealing with this, it isn't a very sought after or well talked about condition yet in mainstream medicine. So would really love to just kind of dive into what drew you into this line of your career and what really created this passion for you.
Yeah. So the biggest thing was me getting mast cell myself. That's how many of us ended up here, right? For sure. So when I discovered mast cell, I had already been sick, chronically ill for like 7 years on and off, and kind of like, what's going on? Already had some diagnoses. So I already knew about Lyme, knew about POTS, had all, reactivated Epstein-Barr, all these kinds of things that just didn't make sense based on the lifestyle I had been living. And it was like, what happened? And then I started out of the blue, had divorced, moved into a new house, and 4 months in, started getting hives head to toe, was in some of these, listening to Lyme podcasts, which was really opening to me. And I actually heard Beth O'Hara, my mentor, talking about mast cell on a Lyme podcast and just all the bells started going off, like, oh, maybe this is something I have, especially since I had so many hives, some anaphylaxis going on and just overreaction to something that we didn't know what it was. Couldn't figure it out. Yeah. That's kind of how I ended up. I was already trained and already working as a health coach. But this was kind of how, so I started at Mast Cell 360 as a client and worked with Beth, which was wonderful. And the first 3 years I was covered in hives until I figured out my root cause, which for me ended up being mold. And took that out of my environment, started to detox, and had a complete, reduction of inflammation and reversed everything. So I had all these diagnoses, the Lyme is gone, the POTS is gone, the POTS is pretty severe, the SIBO is gone, Epstein-Barr, all the infections, all these chronic infections, they all went away, and all the meds I was on went away.
Wow, that's amazing. So with just out of curiosity, like when you were going through all of this, did you figure out that you may have had previous mold exposure, like not just the one that you moved into where you developed the hives, but do you think that was a reason why your body was holding on to all these different co-infections and Lyme and, SIBO and everything because of that?
So hindsight's 2020, right?
Yeah.
Now in hindsight, I realized that the house I had moved from had black mold. And the reason why I knew that is because I had tested some of the furniture from there after, and it didn't make sense that there wasn't those kinds of mold toxins in my house, but it was on the furniture. Like the mycotoxins were from black mold, and they were not in that house. And then it was testing in me as well. So I'm like, where did I get black mold exposure? So long term, like, then you start thinking about when my kids got sick or the dog was sick and why we started to feel all this fatigue and why we all became immunosuppressed. And yeah, it was black mold. So hindsight, I moved out. I think what happened was I moved, had the stress of moving, divorce, being a single mom in some ways, right? And just my body started to detox because I was out of it. And was there a little bit of mold in my new house? Yeah, there was a little bit in my HVAC. There's a little bit, but it wasn't enough to make someone severely mold ill unless you were sensitive. So in hindsight, I think the detox, a lot coming through my gut. That's how I think the SIBO got worse at that time because I was detoxing and my immune system was like really ramped up. Plus the stress piece. So mold plus the stress equals the mast cell to me. That's the equation.
Wow. Again, and that's what I'm always, talking about too on like my platforms is when it comes to mast cell activation syndrome and with any chronic illness in general, but there's like so many different factors that could be playing a part and can be so confusing to the individual because like you were saying, you were diagnosed with 5 or 6 or 7 different things. But then once you start to put the puzzle pieces together and you're like, this is making sense. This is why my body's holding on to this. This is why I'm starting to detox because I left the house. It's starting to flare up certain symptoms. So that's really, really interesting and insightful. So thank you for sharing your story. And also wonderful that you worked with Beth O'Hara, that you worked, that you were a client of hers and that also, that she was your mentor. The Mast Cell 360 website is just an incredible resource that I'm just going to go ahead and early on shout this out for the listeners because I have to say when I was going through all my stuff in the beginning stages, that's what I found. I found that the resources there to be insanely helpful. And I'd love to kind of dive into this next piece where when somebody is coming to you with mast cell activation syndrome and they haven't started anything yet, what are some of the first things that are going through your mind that you need to kind of look into for them, as well as like maybe crucial first steps that you're considering taking with these individuals?
Yeah. So it's kind of looking at, we do a pretty long intake. And so looking through that intake and getting as much information ahead of time, try to get a picture, and then having that first, getting the full picture when you meet the person and they can answer all the questions and details and tell their story. So their story and their history of what happened can be huge. But kind of looking at how sensitive are they? Can they onboard things? Are they sensitive to supplements? Are they sensitive to environments? Have they always been sensitive, or did it happen after a certain period of time? And what happened during that time? So really looking at that mold history, possible mold history, and whether they are aware of it and have done anything with it. And then looking at that nervous system piece. And then also looking at that food piece can be important because sometimes people are just coming in, they're having a lot of food sensitivities, but they can onboard the supplements. And so then we're trying to find the patterns there. One of the first tests we run is that real-time lab urine mycotoxin, which for most people, it's going to show something. Even if it's low level, sometimes people will say, well, it's only just a little bit. And I'm like, that's because we're not detoxing well yet. Yeah. And it kind of goes up as we become better detoxers. So we start by looking, making sure that there is a mold exposure there before we do a mold detox. And then checking that environment, because if we're in it and we're trying to detox, it's more maintenance. It's not a true healing. So we just want to really kind of get that out of the way for people.
Amazing. And so let's say then you're assessing this individual and you're looking at all these different pieces, like you mentioned, like nutrition, supplements, nervous system, environment, like all these pieces are so crucial and factors and playing into like, how can we get this person stabilized? So let's say that they are unable to tolerate any supplements. Like they've tried everything under the sun. They're reacting to even the smallest little fairy dust sprinkle of a supplement, and they've done that with multiple things. What are some things that you're considering that they need to do then if they can't onboard a supplement or maybe even certain foods? Like what are you considering then that they need to look into to help them regulate and help them be able to actually tolerate supplementation?
Yeah, one of the biggest things is that nervous system piece. And really kind of calming that down, because it's our protector, right? It only cares about our survival. It doesn't care about our thriving, and it can overprotect or be over hypervigilant. So if somebody has had a lot of trauma, or, it can be small t trauma too. And, we were talking pre-show a little bit about how just getting to figure out that you have mast cell can be a trauma unto itself, because it's very misunderstood. The family, you might look okay some days and not okay other days. So family members, close people might not understand what you're going through. So there's some trauma in that. And then there can be childhood trauma for sure that set up your nervous system to be more highly hypervigilant. So really looking at the nervous system piece, but I also get really curious about what else is going on for this person. get really curious about their flares. I know nobody likes the big flares, but the big flares are kind of sometimes the stories, and that shows a pattern where, somebody might have tried a lot of herbals and had a lot of reactions. Well, that might be salicylates possibly, or salicylate intolerance that's not there forever. Mm-hmm. Or if they have had a lot of joint pain and, UTIs that felt like UTIs and might have been more an oxalate issue. So looking at those, because those can be big drivers of inflammation and hypervigilance in the body, but kind of trying to look at and do a little bit of each depending on what's going on. And it is like layers, getting at layers for people.
I love that you and the rest of the Mast Cell 360 clinic really harps on that nervous system piece, because I personally found that with myself, but then also with, many people I work with or talk to, that there's so much of their ability to be able to onboard supports or tolerate things or just get started and then continue onwards with having like maybe an even more efficient, supportive, like healing journey is getting that nervous system regulated again. And something that I always loved that I would hear Beth O'Hara say was mast cells lie at every nerve ending. So there is that constant communication with the nervous system. And then again with, the mast cells, and we can't get in there with supplementation. We got to break the cycle somehow and work on the nervous system piece. And I like that you're mentioning different forms of that nervous system dysregulation through trauma, through, just overall stress and things like that. So, out of curiosity, what about limbic system retraining? Do you find that implementing that early on is helpful for people, or do you tend to maybe go towards more parasympathetic nervous system balancing and then layer in the limbic support later?
So we like to look at both. And I know Beth taught me well. She was just like, make sure they're not doing one and not the other. Because if you just do the brain retraining, which is the limbic piece, and don't do the vagal piece, it can ramp up in the other part. So there's the top down piece or the bottom up piece, right? Which is the vagal to limbic. So we do a little bit. My favorite program for it, or one that I've seen has helped people the most, and I think it's because it's so comprehensive that it does both of those things, is Primal Trust.
Mm-hmm. Yeah. Amazing. I'm actually bringing Dr. Kathleen King on in September to interview her with Primal Trust. So I'm very excited to do that. So very cool to hear that you say that that's what you found to be very helpful for a lot of the clients you work with.
It is. I mean, there's some people who are so sensitive they can't do that. They can't do the video. They need to do more one-on-one support with like our emotional support coach, or they need to go slower and gentler and just need to get outside and maybe ground and be in nature if they can. But Primal Trust has been one of the programs if they embrace it, and not everybody embraces it. But 50% of mast cell, at least 50% is the nervous system piece. Mm-hmm. For some people, it's 80-90%. Mm-hmm. So getting those tools, which can seem so simple, and it doesn't mean it's in your head. It is like you were saying, the nervous system, the nerves communicating to the mast cells. Are we safe? Are we safe? It's all about getting back to safety in the body.
Yeah.
And it got a lot of danger signals from being in mold. When you're breathing in mold, or around mold, or the detox of the mold, there's a lot of communication coming from your body. Like, this is not safe. There's a lot of toxins coming through here. What's going on? Mm-hmm. So just that alone can ramp up that system.
Absolutely. It's bottom line. It's like that cell danger response model too. It's, it's the body's just feeling unsafe, and what can we do to get it to feel safe again? Yeah. And something I want to touch on really fast too, that you mentioned that I really love and that I want people to like really listen to, is that you said that maybe we don't want to ramp up the nervous system regulation too quickly, because in that sense, that can potentially be too much, almost like a supplement. It can be too much for somebody to handle at once. And I love that you mentioned maybe do something very simple, such as grounding outside, or maybe some small breath work, or whatever it is for that person that they can handle, and probably working and layering in that piece. Because again, it is like with Mast Cell Activation Syndrome, like you guys are working on in the clinic, it's a layering effect of what we can do to continue to make the body feel safe and stabilize, right?
Yeah. And sometimes people come in, so people will be two speeds. Like they'll either be the freeze state of nervous system where they're afraid to step forward, in that limbic piece. And so then we're working with them to baby step and sort of expand on that. And if there's a lot of people who come in who want to run to the other side and be well. And I understand that, don't we all? But if we keep running, we don't you need to kind of slow down to heal.
Yeah.
Because we're stuck in that parasympathetic state. I mean, the body just won't detox well. Nothing, we won't digest well. Nothing works well when we're in that sympathetic state. Yeah.
Absolutely. Absolutely. And to kind of continue onward with maybe some other supports or things that maybe you're looking into, I'd love to talk to you a little bit about maybe nutrient deficiencies, because we know through stress, through chemical exposures, mold exposures, toxin exposures, all that stuff, et cetera, the body is working overtime to help us. And in result, we can see some nutrient deficiencies, which again can lead to triggering mast cells. So I'm curious, do you see that a lot in the clinic? And if so, are there things you're doing to assess that maybe early on, or do you kind of look to that a little bit later? What's kind of the path that you may take with somebody with that piece?
So I've recently done a deep dive into organic acids. So I've been doing a mentorship on organic acids for like the past 6 months. So I've been doing organic acids, looking at amino acids as well, and then looking at the nutritional component too. The only thing that's challenging is if I run, say, like a metabolomics on somebody that's really it's close to a nutri-eval without having to do a blood draw, which is what I like about it. But it gives a big picture nutritionally, because you need so many of those nutrients to detox. And if you have any kind of food that you can't, food limitations around what you can eat because you're reacting to things, can end up in a dangerous situation where your body doesn't have what it needs to detox. So it is a question of, who is this person? Will they be able to, if this is telling me they need all these B vitamins and all these minerals, are they going to be able to onboard them? Because some people just can't. And so they may need to maybe start with the nervous system and then a little bit later on. But before somebody kind of goes into detox, I kind of want to run that on them so we can optimize, because I'll often find a low B2 or a low B6, and that's a major cofactor to detox a lot of things. Low vitamin D, right? Like all these things that can set off a whole, things get kind of backed up, and we need to support that, the body in that detox process. Yeah.
Yeah, absolutely. And again, to your point and what you're mentioning, and I love all that, is that like that's like a form of stabilizing too, is if we're replenishing what's depleted in the body, like that is almost a form of onboarding a mast cell stabilizer, because we're starting to supply the body with something it's been depleted with who knows how long. And then in turn, like you mentioned, then that's going to help make the detox process that much smoother, because the body's ready to go.
Yeah.
Yeah, no detox reactions.
Yeah, I've had a few vegans come through who had a while, so they have a really low B12 and just didn't have the amino acids to detox. So of course you feel awful, right? So yeah, I mean, then we're able to or somebody's not digesting well. So I've had people who were eating a lot, but if they weren't absorbing those nutrients, it's so hard. So yeah, it's looking at what are we missing. And sometimes it's as simple as those minerals.
Yeah.
Especially if they've had an oxalate issue, they might have been stripped of magnesium and calcium. Hydration is huge, which is not sexy at all. But I literally had a client this week who was having flares, after exercising. Now she's somebody who can do more, but she'd have these severe AFib kind of things. But I'm like, oh, she's getting dehydrated. Because she'd done more, her diet's a little more keto-ish, so that's dehydrating as well. And then, yeah, just looking at, as well, just looking at, what other things can we onboard, like those amino acids. If somebody can't eat meat or digest meat, or their hydrochloric acid has dropped and they can't do it, or they're just not willing to eat meat too. So yeah, we need a lot of amino acids to do that healing and to detox. So, and that can be kind of an easy thing if you can do a really balanced formula, to get on for someone if they're able to. And we start really slow with our supplements. I mean, you know that, right? Like a sprinkle at a time if someone's that sensitive. I mean, we have people come who are robust, can start with a full cap, but many of our clients are opening up that capsule, doing what we call like fairy dust in water, and then taking one sip. and
Mhm.
waiting a few days just to
Mhm.
see, because those mast cell reactions can come a couple days later.
So important. It's so important to take those steps because most oftentimes, I'm sure you see this all the time when people that are coming to work with you, is that they had been starting unknowingly starting at like full doses of everything, not realizing that, even with supplements, little supplements and capsules, like starting at a small dose is so, so crucial and important because it's like slipping that past the little detectors, those mast cells, so that we can sneak it on in there and get that person stabilized. And
Yeah.
I love that you keep mentioning, it's again, it's not just these like stabilizing supplements. It's the nervous system, it's the nutrients, it's the amino acids, the minerals, like all these different things. And are they dehydrated? It's some gut supports. Like it's these like almost like in a way, kind of like simple pieces that we can just really look at, but that can play such a crucial role in getting that person stabilized to then get them to an optimal place to be able to detox. And in that component, do you ever run like genetic testing at all, like looking at genetic SNPs, anything like that? Like, is there anything that you are like considering when you start working with somebody based off of their symptoms, maybe, or like what they're unable to tolerate that might lead you to being like, if they're not coming in with testing already, that might lead you to maybe running a panel or something to assess further of why this person's so reactive
Yeah.
potentially?
Yeah, we don't right now. We're not. We move the genetic component to the end on
Okay.
optimization more, unless there's some blocks and people are not getting there. Um, and sometimes those genetic things can show up in some of those amino acid testing. Like if you see
Yeah.
some things really off, that might point that there's some enzymes missing. That and it's like, maybe we should see somebody about that. But currently, we aren't doing the genetics up front, more because Beth was like, people were getting hung up on, I can't get well because of these genetics.
Mm-hmm.
And what she found more to be true is, let's do all the pieces around the lifestyle and the environment and the
Mm-hmm.
supports to move them forward. And of course, if there's healing blocks along the way, kind of questioning, and then there's certain people we will refer to more look at those genetic pieces that they might be able to optimize, even nutritional supports and things. Yeah.
I really love that. I really have been a firm believer that the body can tell us so much. We can work with a lot of pieces in other ways. And sometimes too much testing and too much labs and information is just, that's in itself like a stressor and
Huge
just creating
overwhelm.
that dysregulation in the body.
Yeah. Yeah.
Yeah.
And I've kind of simplified up front too, because we used to do more chemical toxicity, like look, big picture, but it would kind of freak people out to know that they had all this BPA or the PFAS. And then they're like, what do I do about, and it's
Yeah.
like, let's look at the mold piece and kind of work
Yeah.
on that and work on detox. And if we open up those detox pathways and they're digesting better and they're supported nutritionally, they're going to detox all those other things better too.
I really love that. I really do. That's amazing. And it leads me to the next question then, because of course we keep bringing mold up as a big thing, as part of your picture, part of my picture. I want to kind of hear from you. Like, what do you see as like some of the most common root causes of mast cell activation syndrome? And to kind of add a second question to that first question is, do you see mold in most of the pictures, or are there cases like maybe you haven't seen that as part of like someone's picture?
Yeah. So like 3 years in here with Mast Cell 360, I have not seen one case that did not have mold.
Mm-hmm.
And it could be past, right? They might have moved out
Right.
and didn't even know they were in it, which is possible. But there is that layer that's always there. And some of them maybe have detoxed quite a bit of it and are doing better. And then there's just missing pieces, like maybe the oxalate piece or optimizing some detox pieces. Or that I've had people come from other mold doctors where they didn't look at the mold colonization and they had huge colonization in their nose and they were wondering why their
Mm-hmm.
SIBO was never going away. And I'm like, well, if we have that mold colonization, it's dripping down. It's upstream from that gut. So if we don't address those sinuses, and sinuses were a major issue for them, and then I see them on the other side of that, and it's like, oh wow, yeah. Once that got cleared up, they started to feel so much better, and their gut started to heal. Yeah.
Oh, I love it. Amazing. Yeah. And so yes, same here. Mold is just seems to be a part of a lot of those pictures. And I'm just curious, are there any other common root causes that you typically see as well?
So Lyme is a common one.
Yeah.
Lyme and mold kind of can go hand in hand. So Lyme can be
Mm-hmm.
one. I mean, environmental piece. So anytime that bucket of overwhelm of too much toxicity can happen, I have seen one or two people get a bit with like like heating gas in their home, a leak, like a hidden leak, things like that. Sometimes endotoxins if there was some issues going on, but usually there's a mold component as well.
How often do you see actinomycetes like as part of a picture, potentially that endotoxin piece you're talking about? But
Yeah.
I'm just curious, like, do you see that, and maybe in some cases where maybe you had detox somebody and like their labs are great, but maybe they're still having some symptoms of that toxic burden piece. Like, is that something you've ever found?
I've only had one or two that, and
Yeah.
usually it's like, okay, we need to dig into this deeper because
Yeah.
they did mold remediation and they were doing detox and they just couldn't well, they couldn't really
Mhm.
detox because they couldn't get stabilized.
Yeah,
And
that
so
makes
then
sense.
what's going on? And so we started digging more into Ictino and looking at that. I do think it's a combination of, environment that they were in, and the level of illness they already had, that
Mhm.
there was like multi infections. The thing to know about that is if it is still in your environment, that can play a role, right? Of someone not getting well, but also, it was recommended, I guess, some of the experts against this person moving or her family moving because you can take it with you because it's on your skin.
Right.
So the importance, like that person had to more see a specialist on Actino to really get a good protocol to kind of clean up the skin. But
Yeah.
it's been not that common, like probably one or two cases out of hundreds.
Yeah, I had interviewed Dr. Neil Nathan on my podcast a few months ago, and he said a very similar thing where, in the thousands of patients he had worked with, it really there was not it was a very, very small subset of his patient population that were dealing with that as kind of that last triggering piece. So, that's just cool to hear insight from you as well, and probably what others are finding in your clinic too. So, when it comes to individuals starting to get ready for their detox supports, like maybe layering in those binders,
Mhm.
because I get asked this question all the time on my social media platforms, is how do you know when the right time is to start onboarding these, right? Because a lot of the symptoms too, like there's those mast cell symptoms, but they kind of coincide a little bit with those mold toxicity symptoms too. So some symptoms might be getting better, but they're still having some other persistent symptoms. And, I think for a lot of people, they're just like, I don't even know if I'm stabilized enough. And so is there
Mhm.
any ways that you or others in your clinic as well are using to like maybe assess somebody's ability to be able to potentially handle starting the detox?
So one thing is definitely making sure that phase 3 detox. So are you pooping every day? Because if you're not, it's not going to help at all. It's just
Right.
going to make you feel more toxic. So that's like one thing, at least for the negative binders. Um, the other piece is, yeah, are they having reactions all the time? Have they gotten out of mold? And then, yeah, could we baby step into some? Now, for some people, even if they're not able to have a bowel movement every day, I'm able to add some positive binders like a
Okay.
Saccharomyces
Hmm.
boulardii or L. rhamnosus or something like that,
Yeah.
that can kind of crowd things out. And then if they are, then it's kind of layering on. Can we do a little bit of charcoal? And how does this person feel when they get some charcoal on? Because sometimes people are
Yeah.
like, whoa, I feel so much better on the charcoal. Because I'll tell clients, your body doesn't wait till you say, hey, I'm going to onboard this binder. It might start detox before that. So you might feel awful because you don't have those binders.
Right. Right.
So we're trying to assess that. But yeah, can we get that binder on? And sometimes people do feel a lot better not having those toxins recirculating and getting those binders on. So yeah, stepping into the charcoal, which most people do pretty well with, and then trying to
Yeah.
layer on the others. Yeah.
You mentioned making sure that they're out of mold. What if in this scenario, someone either due to cost, right? They it's
Yeah.
hard to move, or maybe they themselves are so debilitated it's just hard to even imagine like moving. But maybe they just need to start some sort of supports. Like, have you ever maybe started, maybe not for everyone, but, in some cases, is there a case for being able to start like a gentle binder or two, or maybe like you mentioned, the positive binders just to kind of
Oh
support?
yeah, as long as yeah, they're able to handle it on board
Yeah.
some supplements.
Yeah. Right.
Um, Maybe a little charcoal. I like to do nasal silver too when they're in mold, because that might protect them a little bit from that sinus colonization, perhaps. And then there's a lot you can do to clean up the air, whether it be, a lot of times it might be somebody's renting and their lease isn't up for another, 5 months or so. So could they do some fogging or something like that? Non-toxic fogging. Yeah.
Yeah.
So kind of looking at, can we get an air purifier in there? Can we open the windows? Can we do a deep clean? Those kinds of things that might bring some of that down, and they might need to fog every month until their lease is up.
Yep.
Or it might be a while till the remediators get there too. So how can we clean up that air quality? Yeah.
Yeah. I really like that you're mentioning the environment piece, because that's huge. I know when we lived in our first moldy place, we that's what we did. We were, air purifiers, fogging, making sure we were wet dusting and, vacuuming as often as we could. And that piece alone really, really did help a lot, just reducing the load that our body was getting exposed to, which is so important. And so in relation, again, kind of to the binders, you kind of already touched on this, but maybe we can go a little deeper dive. Are any particular type of binders that you tend to find are easier for those that are with mast cell activation syndrome to onboard first? And do you consider, doing some bile binding any specific binders that seem to be best for those with mast cell activation syndrome?
Yeah. I like the single ingredients binders, so we kind of know versus like a really strong multi-ingredient one. So yeah, the activated charcoal, bentonite clay, like a really clean one, and a really clean chlorella. Are like the three negative binders that are our mainstay. Sometimes, depending on what mycotoxins came up, we might be adding in some zeolite. I never like to do zeolite without another binder because you're moving metals. And then, I really like propylmanin, which is from konjac root. Depends on how your gut's doing, because it is a fiber. So some people will bloat, so you got to go real slow. But it can help, with that. If you're on some negative binders and things have slowed down, that propylmanin can kind of move things through. And some people do really well on it. Some don't. So it just depends on kind of what's going on in the gut. Saccharomyces boulardii. I feel like if people go slow, they can usually do pretty well with that. Depends. And then Lactobacillus rhamnosus is the other one that I really, really like too. That's a positive binder that is a probiotic strain. Really helps with that trichothicenes piece, especially.
What about if somebody is, let's say they're working up to the dosage maybe you recommend is like, this is the dosage, let's try to get up to charcoal, and then we can move on to the next binder or whatever it is. And you say this is like, the highest dosage to get to, but are there often cases where they might feel good at like half the dosage, but the moment they try to go past that, they don't feel well? So in that specific case, do you find that they're still able to detox fine at that amount, and maybe the detox just takes longer and you're just kind of working on implementing some of the other binders just to get more onboarded at whatever they can tolerate?
Oh yeah, absolutely. Sometimes people, generally it's like try to get up to 2 caps of charcoal. Some people can only get to 1, and that's okay. Maybe it's too constipating beyond that, or beyond that is just too much. So that can do a lot, just that 1 cap. And then layering on some of the other things. Some people just can't do clay. Some people can't do the chlorella. So it just is kind of playing with what are you able to onboard, and coming back to it maybe later if things aren't clearing certain mycotoxins, and kind of like, can we onboard it now when we're at a place maybe we've gotten rid of a bit of the mycotoxins is there. Now, could you tolerate more?
Okay. Love it. Now, let's say I'm throwing a few scenarios at you. So let's say then somebody has tolerated everything up to that point of then onboarding the binders, like you mentioned, they've done their mast cell stabilizers. They got some of those on board, and maybe some of the nutrients or minerals you mentioned, some of maybe gut supports to help with the gut motility, right? That phase 3 detoxification. Let's say that they're trying to onboard charcoal or L-rhamnosus or, the fiber powder or anything, and they are just not tolerating it. Is there something that kind of pops, or a couple things that pop up in your brain that's like, okay, I think we need to maybe circle back to this piece and re-regulate here, or maybe do another test for this? Like what kind of comes up in your mind for that
Yeah.
person?
Yeah. So, well, very much looking at elimination. Like, what is it that things are slowed down? Bile is huge. So it could be bile insufficiency, right? So they might need something like ox bile, or um, I'm going to say TUDCA, but a lot of people can't with mast cell can't do TUDCA too early.
Yeah.
So looking at some of those things, that could we really, bitters support bile production, because that might be part of it. And kind of really trying to assess what's going on. Or is it that gut is so hypervigilant that it doesn't want anything kind of coming through there? So sometimes it might be, how can we sort of support the gut and heal the gut a bit? That gut lining can be pretty torn up if we've been detoxing or colonized there, or detoxing oxalates is a big one that gets a lot of people in the gut. Because I tell clients, I'm like, that's like detoxing shards of glass. So of course it's going to be hypervigilant. Like, why are you eating glass? Right? Obviously you're not eating, but like, why is that coming through? And don't send that through, because it's really rough on that gut.
Mm-hmm. No, that's great. And I love that you brought the gut terrain piece up, because that was going to be a follow-up question was, again, it just with so much information out there, it can make people's headspace just go absolutely nuts. Like, where they're like, should I be working on the gut and get rid of the SIBO and the candida and everything before I work on the mold, or should I do the mold and then this or that? And so I know that you guys, as part of the clinic, are really working towards making sure that at some point that gut is optimized and continuing to rebuild even after detoxing. But are there cases where somebody's had maybe, like, let's say, like very high amounts of SIBO, like gut dysbiosis, where maybe that terrain really did need some addressing maybe before starting the detox? Because again, SIBO, we're seeing high endotoxin load, like you mentioned earlier, and that's creating inflammation, clogging up liver detox pathways. So we kind of want to get in there and support too. And so is it just kind of a case by case basis in terms of like what type of gut support someone might need before onboarding like their detox supports?
Yeah, I mean, we do look at, kind of how is digestion going, and how is their gut doing, and how's their gut handling things. But definitely always trying to think about that gut lining and what can we do. I mean, one trick I do for some of our people who are most sensitive, who really need to get that gut lining healed, and this is from Beth, is like just cold juicing cabbage, raw cabbage, is vitamin U and can really work on that gut lining, because they might not be able to take a supplement or do some of the others. And that's like low salicylate as well. So they're doing, a couple ounces of juice several times a day to kind of work on that gut lining and healing that gut lining. So yeah, if that gut lining is pretty raw and not doing well, healing, that's going to be important before pushing a detox through there, because I think that's going to set them back. Butyrate, if they can tolerate it, can be very healing for that gut. I love like marshmallow root, diglyceride licorice, slippery elm, zinc carnosine, if they can't do some of the herbal stuff. But yeah, trying to think about all those things that they can do, and time, right, to kind of heal that. Because trying to push toxins, even if they're kind of bound, because they're not completely bound, through there, can set us back. Yeah.
Mm-hmm. Well, I remember you said something once to me that always stuck, but it was, detoxing is good of a thing what we're doing and getting this out of our system. In a sense, it is kind of trashing the gut too, right? We're bringing these substances through. And if somebody does have that little bit more of a sensitive gut prior to even maybe dealing with all this stuff, then having some gut supports onboarded, like the ones you mentioned. I know butyrate was always very helpful for me. That can be like a game changer for some people just to get them through the detox, like nice and efficiently with minimizing those detox reactions.
Yeah. I think the analogy I usually do is like, it's kind of like if you're taking the kitchen, like the kitchen trash through the kitchen with a hole in the bag is kind of like detox, like every day, right? So it's like you got to keep kind of cleaning up the kitchen because it keeps coming through. And if it's just a little hole, it might be a smaller reaction than if we try to push a big, huge amount through. So yeah, it's like continual cleanup, but knowing it's not going to be like perfect, like. And it's not, nothing is ever kind of like, oh, we healed SIBO and then this, right? Like it's kind of, yeah. And I even myself, my own journey, like I kept testing SIBO and talking to doctors about treatment. And Beth's like, stop testing. We know you have SIBO. It's going to be, if we're going to keep every time we detox, we're bringing detox through there. So it's going to get dysregulated a little bit. So she's like, don't worry about it. But if we're past detox and it's still an issue, then yeah, it's so much easier to treat on the other side. Same thing goes for Lyme.
Yes. Do you ever find that in the cases of somebody that maybe had some, moderate, severe SIBO, whatever it is, right? Enough to where it's really, if anyone here is listening has had SIBO, like Kimberly and I both have had, it's that SIBO bloat that you'll never forget. It's very uncomfortable, but there's other symptoms as well. But with that being said, a lot of people really want to get in there and get after the SIBO, but a lot of times they've been on like probably 10 different SIBO protocols, and maybe it's helped a little, but it always comes back because of that underlying toxin piece. Do you find that once you address the mold and you address the detox, like, do you find that most of the time that SIBO resolves, or maybe you need to do like a little support after for it, some antimicrobials for it, or how do you usually?
I mean, I love Ontratil, right, for some symptom support if you're not salicylate intolerant, right? That can be a huge support up front. But yeah, I do find that once you kind of clean up that terrain, and the way I think of it too is like, say there's mold colonization there. I feel like it's like, how would you got to clean the terrain first before you try to fix and repopulate. So like you have to work on that terrain. And like, I feel like the mold piece is a big part of that terrain.
Definitely. So one of my final questions is in regards to maybe somebody's journey. And again, it's going to be different per person depending on like how sensitive they are by the time they come and see you. But is there kind of an average amount of time that you typically see somebody from like the start of, trying to start stabilizing to the end of when they start detoxing and rebuilding, like a time period that it might typically take for somebody to, and of course they'll start to get better as time goes on, but maybe start to achieve that like, 80, 90% of like that vitality that they've been wanting to have for a long time?
Yeah, we tell people, and it depends on how sensitive they are. Because I've literally had people that were not hypersensitive and it was a big nervous system piece that they needed to work on the nervous system for a year. Wow. And then they were able to onboard foods and supplements and start to move forward. But we say in general, the journey is somewhere in the 3 to 5 year range. Yeah. It doesn't mean it takes 3 years or 5 years to get perfect, but like, usually give it a good 6 months to a year, right? To kind of calm the mast cell response down and kind of figure out all the pieces and then start to be able to detox. But most of the journeys that I've seen that people are kind of what we call graduated, right? Are kind of like a 3-year journey. For some people, it's more 4 or 5, depending on how sensitive they are or how fast they can go, right? And some of it, they maybe want to go fast, but their body won't allow it. And other people, from a nervous system perspective, are not able to go fast, but their body is. So yeah, it's kind of got to line the two up.
Definitely. Awesome. Well, Kimberly, this was a really insightful, amazing conversation. You are a wealth of knowledge, and I am so excited for the listeners and everyone to listen to this conversation because, again, so many people dealing with this hypersensitivities, unable to onboard supports that they need to help detox and get better. And, this is such a big, crucial missing piece in a lot of people's journeys. So I'm grateful to have you on here. Thank you so much. And I'd love to leave it to you to explain like where people can find you, work with you, and any other pieces of information that you wanted to mention before we let you go.
Well, thank you so much. It was so much fun to talk to you and kind of share some of what I've been learning and have learned there, and some of the successes we've had, which it makes it all worth it, right? To see people getting better. In terms of being able to where you can find me, Mast Cell 360. I'm a lead practitioner there. Can apply to the clinic. And actually, we're taking people worldwide right now. As long as you speak English, and because that would be a barrier. That's where the best place to go. But we also have, and I like to tell people, like you were saying, it's a great resource. The Facebook Lives, I'm on there most Mondays, but they're recorded. It's also on YouTube if you don't do Facebook. We also have a lot of blogs on all of this, so come check us out there. And then also, I'm going to send to Stephanie a link for our what we call our nervous system dysregulation quiz, which can be really eye-opening of how dysregulated is your nervous system. And I know for me, it was eye-opening. I took that back when, because I was like, oh, I don't have a lot of trauma. And then I took it and I'm like, oh no, we have some stress. So I think the human existence there's a little bit of trauma, just being human, right? But going through Mast Cell for sure. So it's a free quiz, can kind of give you an idea of how dysregulated you are, and make you kind of think about, maybe you do need some nervous system support, especially if you have Mast Cell, and some tools that can really support you through the journey and kind of help calm at least that nervous system piece that you're able to detox a lot easier and a lot quicker than if you were.
Oh, thank you, Kimberly. Yes, I will definitely include that link for everyone in the show notes. I myself also took that quiz years ago, and it was very eye-opening for me as well. So highly recommend taking it. And then, of course, checking out everything at Mast Cell 360, because it really is at a super resourceful website. It's amazing. But thanks again for being a guest. So lovely to have you, and can't wait for people to listen.
Thank you so much.